They talk about the average 11.4-hour workday, that almost 6 of those hours is spent in the EHR itself. We've really turned clinicians into, I don't know, they're navigating the technology and spending an awful lot of time in the technology. I was with a CIO 2 weeks ago. I was in his office and he showed me this report, and it was a great report because it showed the usage of the EHR by physician. And he goes, "Is this the saddest graph you've ever seen?" I'm like, "Explain the graph to me." And he said, "Look, this person woke up at this time and they got into the EHR and they were working on the EHR from home. Then they came in and they worked a full shift." And he goes, "Now they go home and they're working an additional couple of hours on the EHR." He goes, and I'm like, "Well, now that you describe it, yeah, that's the saddest chart I've ever seen." He goes, "This isn't like a one-off, one-day kind of thing." He goes, "This is her consistent pattern of using the EHR. It is multiple hours when she gets up and multiple hours after she goes home." And you can understand where burnout's coming from if that's the way. Now, is that a result of? Do you think that's a result of the design of the EHR? Is that a result of the changing landscape of healthcare and the dwindling amount of time we have with the patient, that we're saying to people, "Hey, you got 11 minutes to be with that patient. Get in there, get out," and you have to document outside of that environment? And what's causing that kind of environment where people are spending all that personal time on the EHR?
I think it's actually all of the above. I think that there absolutely is increased pressure, to compress the amount of time you spend with patients so that you can have higher volume. I'm hopeful, because I'm an optimist, that, as we move from volume to value in a healthcare model, that, there's potential for that to improve. But I think that said, there is still a great variety in terms of skill, right? And some people have learned how to navigate their practice and engage with patients at the same time as they document, and others have not. And in some cases, they have not on purpose, right? And when I say on purpose, I mean they have a higher value on that interaction with the patient. And I think that this is an opportunity for other technologies to really play a part in voice navigation, so that really documentation and ordering and all of the EHR related processes become a byproduct of what we do with the patient, as opposed to yet one more thing to do.